Our mission at Chuback Medical Group is to restore health and overall wellness to our patients. And we do this through compassionate and expert care.
My vision for the practice was to provide great care to the public and fulfill my Hippocratic oath to take great care of people in an ethical and conscientious way.
The way we go about carrying this out is through our commitment to a very caring and responsive relationship that we have with every patient. We stand strong as an independent practice where we say how our patients are going to be treated by medical best practices. We say that we're going to take the time to know our patients and their families. And this is our commitment to our patients.
The growth of Chuback Medical Group was very much organic. It was never my intention at the outset to have it grow in the various directions that it did. As a physician, your job is to provide improvement. When people are sick, you want to make them better if you can't make them well. But oftentimes, in this field, what we're doing is we're making people better.
When you look across the landscape of what's happening in the healthcare industry, you're going to see more and more consolidation of medical practices into hospitals, overtaking by private equity firms. This kind of thing, it changes the way patients are treated. The focus becomes less and less around the patient, but more toward business things like doctor, productivity quotas or shareholder responsibilities. We're talking about human beings here and their care, and this is not the case at Chuback Medical Group.
I think that what separates us from the vast majority of practices out there comes down to the people. I had a professor when I was a general surgical resident, and he used to ask a very strange question to the incoming residents. And that question was, who, what, why, where, or when? And of course, the residents would be a little bit perplexed by that. But the answer was, who? The answer is always the who. Who was there? Who was the doctor? Who answered the phone? Who was the patient? Who was the assistant? Who is the essence of everything. Everything else is bricks and mortar. You can put up pretty wallpaper and nice flooring and art on the walls, but that's not going to make a great medical practice. It's not going to make a great hotel. It's not going to make a great hospital. It's not going to make a great car dealership. It always comes down to the who, the people who are involved. And we have done a tremendous job under the guidance of my wife and our Chief Executive Officer, Diane. She has really done a phenomenal job building a world-class team of people.
Our core values here at Chuback Medical Group start with excellence. Excellence in the way that we treat patients and our competency levels, our professionalism. And layered on that is the compassion that we give to our patients, as well as making sure that we communicate properly with them. Our staff works with integrity at all times and really embraces the concept of teamwork.
My ultimate goal at the end of the day is that the patients have a safe, friendly, and seamless experience here. We believe education is a priority, which allows us to then maintain a state-of-the-art facility. The majority of our clinical staff and our clerical staff will go for our CEUs. They're always making sure that they are going to conferences, seminars. We stay abreast of all the latest and greatest technology that we can offer our patients.
When you put great people in place, those people will always take great care of your patients.
They are the heart and soul of everything we do, and their careers mattered greatly to me. I always encourage them to grow professionally and personally, because the expert care that our patients receive is a direct result of having team members that feel very fulfilled and dedicated to their jobs.
One of the most important things in medicine is to treat each patient as an individual. Each one has their own primary concern when it comes to their varicose veins.
Blood in your legs is supposed to come back up to your heart, okay? And you have valves that kind of help move it along. When you have varicose veins and venous insufficiency, the valves aren't working properly.
Most people take a look at their legs and they think it's vanity or it's a cosmetic issue when they see these veins in their legs. Unfortunately, venous disease is progressive, and if it's not treated, it can be very debilitating and deteriorate your quality of life.
So I started noticing I had a lot of swelling in my right ankle particularly, especially after being on my feet for duration of the day.
My legs were tired. They got hot and itchy in certain spots, which I didn't know that was because of the veins.
It kind of felt like tightness into my calves, rubber bands, kind of like gripping around my ankles.
By the end of the day, my legs were dragging, you know. The most I could do was get home, sit on a chair, and just put my legs up.
I noticed a lot of dark purple, discolored veins along my whole, around my knees, into my legs, and even my thighs.
When these veins start to expand and you can see them in your legs, you get symptoms of cramping, itching, swelling. It becomes very difficult to even do the most normal activities you used to do.
A lot of patients come in thinking that, oh, it's, you know, my vanity, and it's not. But it is a medical condition, easily treatable, and it is covered by insurance. A lot of patients don't recognize that.
With the new technology that came out, the laser-based, what we call endovenous surgery, minimally invasive surgery, or procedures really, that are done in the office, there was a paradigm shift in the field. The patient can immediately go back to work, immediately go back to exercise, immediately go back to their normal routine, because we're working under local anesthesia, which is very, very safe, no sedation, no general anesthesia.
I look forward to my sessions with Dr. Chuback, and to have him do the work on my legs, it's unbelievable, virtually painless.
He really completes the procedure so quickly because he's so good at what he does. I'm like, that was it? It's over already? And he's like, yeah, that's it. You get to go home now. The procedures were so easy, I would even come on my lunch break and go right back to work afterwards.
And today, my wife is telling me that my legs are looking better than hers, which I can't believe. You know, I didn't want to go on the beach. I mean, my veins were like ropes going around my legs. And today, you don't see any of that.
After I had the procedure, it kind of gave me like a more pep in my step. Like I felt like I had so much more energy in my legs because the toxic veins were gone. To feel the difference was amazing, and I like wanted to go to the gym more, and I wanted to do more because physically I felt better.
I have energy now, which I didn't have before. I feel good about myself because of Dr. Chuback and his whole group.
By the time they're done with the procedures, I mean, patients come in here with cookies and cakes, and they're giving us hugs, and they're just so happy. And it's amazing to see how they went from uncertain and unsure to having a greater quality of life. And that is what we're here to do. That is what it's all about.
Hi, I'm Ileana and I'm 32 years old. I'm gonna be a bridesmaid for the first time in my friend's wedding. There's gonna be a lot of photos taken, and I wanted my crow's feet and my frown lines to be less noticeable. I found myself buying very expensive topical creams, and I wasn't getting the results that I wanted. I've had friends who've been treated with Botox Cosmetic, and I thought, you know what, now it's my turn. I made an appointment and I found out it's right for me. I wanted to know what to expect, and my doctor took the time to explain the treatment procedure as well as any possible side effects. So that made me feel comfortable. I started to notice my frown lines soften at about day 7. And it's been 30 days since my treatment, and I'm happy, very happy with my results. I can't stop looking in the mirror. I think my results are noticeable, but I don't look like I've had work done. Now I don't feel like I'm covering up my frown lines and crow's feet because I talked to my doctor about Botox Cosmetic. I didn't do this for anybody else, and I did this for me. And when I look in the mirror, I still see myself. It works. I know that millions of people have experienced Botox Cosmetic, but I had to see for myself. I'm so glad I did it. It was important to me that I could still make expressions and I can still frown and look surprised. Yes, I'd get treated again. For me, it was the right decision.
Ultimate Aesthetics has been a great service line. This is where Kristen Soha, our physician's assistant, has been so instrumental. Initially, she came to join me to kind of offload some of the volume I was doing in Botox and filler, which those injectables have now expanded to a tremendous number of products compared to when I was doing it about 10 years ago. And Kristen has really grown that service line tremendously, adding laser hair removal, tattoo removal, cool sculpting, and Kybella, a whole myriad of injectable products as well, which have had a tremendous impact on our practice, and I think have made a lot of patients very, very happy over the years.
Aesthetics patients are amazing in that they range, from 23 years old to 63 years old. So as you can imagine, it's a challenge for me because everyone's a different age, everyone is at a different stage, in their journey through life. They have different facial anatomy, they are wanting different end results.
The results are always natural. Somehow she does customize it to my needs, and I guess whatever I portray to her of what I want to see, it comes out the way I envision. I firmly believe it's her technique and her ability to, look at somebody and really customize what or how much that person does need.
The nice part about my job is being able to deliver on their expectations, and meeting those expectations is extremely satisfying and gratifying. But I would say across the board, in general, most patients just want to look better and feel better. And the Ultimate Aesthetics program really allows us to do that for patients. I see 23-year-old patients. What's great about them is that they're not really trying to look different. They really just want to maintain what they have. I also have 63-year-old patients who don't want to look like the 23-year-old, but want to look softer and refreshed and more rejuvenated. And I think both expectations are completely appropriate.
Like I said, I think she is honest. I have come in here before and was like, just freeze my face. I don't care, I don't want to see movement. But she doesn't just do that. Like I said, she doesn't just do what I want. I think she really takes the time to really think about what would be the best look for me. And sometimes less is more, or she's always saying, come back. She's not opposed to, doing more, but I feel like she feels you can work your way up to your goal.
A long time ago, surgery was the only option. And now there is so many more other non-invasive procedures that patients can do with minimal downtime. The expense is significantly less. Anything that we can bring to the table that will get them to where they want to be, we want to be able to offer it to them.
Yeah, I'm not insecure to tell people what I get done. I know most people think, oh, she only looks like that because she got surgery or she got this. But again, I don't feel that there's anything wrong with trying to, make yourself feel better, and however way that is.
Your typical cosmetic patient is looking to get rid of fine lines and wrinkles. They're looking to replace any volume that's been lost over the years. They really want to even out their skin tone and texture. So overall appearance is going to look more youthful, more plump, more refreshed in dealing with everyday life.
We are proud to offer Cool Sculpting in our practice. Cool Sculpting is the world's leading non-invasive fat reduction treatment, with millions of treatments performed worldwide. The New York Times says the leading procedure in the non-invasive body contouring category is called Cool Sculpting. New Beauty magazine readers voted Cool Sculpting tops for treating fat pockets and freezing them away. You may be wondering if Cool Sculpting is right for you. Ask your clinician for a Cool Sculpting consultation today. Mirrors. They show us all our problem areas, those places where we carry excess fat. Perhaps you've noticed that your clothes don't fit the way they used to. Or maybe you've been working out but still can't seem to lose that stubborn fat. Cool Sculpting targets and eliminates fat in problem areas such as your abdomen, flanks, and thighs. You can reduce that excess fat under your chin, eliminate unwanted back fat and bra fat. And now, thanks to the latest Cool Sculpting technology, reduce fat on your upper arms. Love what you see when you look in the mirror. Ask your clinician about Cool Sculpting today. Cool Sculpting is a patented cooling technology that targets and kills fat cells with no surgery or downtime. Your clinician will work with you to develop a treatment plan personalized to your specific fat reduction goals. Each treatment lasts as little as 35 minutes. During treatment, your Cool Sculpting clinician will first attach the applicator. This non-invasive procedure freezes the fat away without harming the skin. During the treatment, you can relax, read, browse the internet, or even nap. After treatment, you can immediately return to your normal daily activities. You may start to notice results in a few weeks, but best results are seen in about 2 to 3 months. Cool Sculpting treats the problem areas that bother you the most.
After getting the Cool Sculpting procedure, it gave me back the body I had before I had kids. I feel much more confident.
It feels so good to just put on anything and know that I look as good as I've ever looked. I don't have to think about what I wear and how it's gonna make me feel anymore. I know everything I put on is gonna make me feel good. And that's a new feeling.
Just makes you feel kind of a little bit more like, I can do this. I can do this.
Now's the time to see a slimmer you. Take the first step and get your Cool Sculpting consultation today.